I'm Elizabeth Hallgren with Mission Direct Primary Care. We are a direct pay membership-based family medicine clinic. I think everybody here today knows us. And I want to welcome Heather Eden from Zion Health. I'm here with Dr. John Hallgren, who you also know, the medical doctor of the practice. But what we're trying to do with this little series that we're putting on is just expose people to different options for their health coverage piece of their healthcare plan. And we're going to be doing this one and then a next one next month focused on small businesses. Zion Health is a health share plan, and Heather's going to go into what that means and how that's different than an insurance plan, and kind of how that works to offer really nice benefit for small businesses. And I want to say thank you, Heather, for coming today and being part of this discussion. Let me know if I got your title right, Director of Business Development.
Yes.
For Zion Health. So I will turn it over to you, make you the host so that you can share and run the show, spotlight your video, and then...
Here we go. Great. Hi everyone. You do look nice, Eric. Thanks. That looks great. Thank you, Elizabeth. I really appreciate this opportunity to be able to educate and let you in on what a health share is and how that really can combine with a DPC practice for a total healthcare solution and really save an employer up to 50 to 60% of maybe the solution they had before. So I'm going to work on sharing the screen. Here we go. All right, Zoom meeting. Perfect. Thanks for your patience while I get that rolling. Okay. All right, now I don't have to be on camera. All right, perfect. So I just wanted to give a thank you to Elizabeth and to Dr. John Hallgren. They have been great to work with from the beginning, very knowledgeable. They really know what they're talking about, and we just love DPC practices like that. I'm here to answer any of your questions about health shares and about Zion Health. So like DPCs, we're advocates for a different way to shop for your healthcare, a different way of consuming healthcare. What we're used to normally is an insurance model where the insurance tells us, who to see, what procedures can be covered by them, and even prescription medications that they will or will not participate in. And so we really feel like that this model is putting the patient back at the center of care, that the patient and the provider get to choose between themselves what is the appropriate care. And Zion Health is really part of that model as well. We believe in their vision, and we're excited to be part of it, and we hope that you see that too. So where the DPC is there for the preventative and everyday portions of the healthcare, Zion Health is really the other puzzle piece to that solution, where it's there for the larger, more unexpected needs, sometimes called catastrophic, subjective term as you will. And when you put those two together, you really have a complete healthcare solution. And you'll see the rates for both with the DPC membership and with our Zion Health membership, you're going to save 50 to 60% of what you would be contributing to a traditional insurance plan. If you're over 50 employees, and I don't think that we have any here, meet with me. We can design a solution with that as well. We have a TPA that stands behind us, and they offer some great solutions, HSA, MEC plan, that help you be ACA compliant if that's what you're needing. All right, I'm just going to jump right into about Zion Health. We are a health share. If you're not familiar with a health share, this is not a new idea. It's been around since the 80s, and obviously it's done very well because it's still up and going strong. The history of a health share is that there was a beloved pastor in a Christian ministry, and he had a large major medical need that he could not take care of on his own. And he was so well loved by his congregation that they all pitched in a portion and took care of that for him. And that worked so well that they continued on doing that. And so when you hear about cost sharing or health sharing, you'll often hear that it's religious based, that you have to be a Christian to be able to participate. And that's why it comes from the origin of that idea. We are not religious based. We don't require any of our members to be part of any religion. We are, let's see, what our founders have done is taken the best of what Health Stars offers, that community feel, that same, caring for your beloved pastor, and created Zion Health. They've took out all of the barriers to using a community service like that and created something simple, something direct, and something transparent. So when we know when members are shopping for their healthcare, we want them to be able to have all the information out there to be able to make an educated decision. And what we have done is built from the ground up. We put our members first, we take care of our members, and we feel like once we do that, the rest takes care of itself. And it's been true. I invite you to search us out for reviews, visit our website, and even jump on the chat with us here. We have a little chat feature down here in the corner. Our member care team is always on the phones, are always answering the chat, and we think that's what puts us above and beyond and first. So as of August 2020, we're currently at 10,000 members and growing at a rate of about 30% every month. So our membership experience is kind of above the rest if you wanted to research into that. So on that note, this is our website, zionhealth.org. It's very simply designed. Everything that you can expect from us is found online. So I'm going to go here to our membership guidelines. This is everything that you can expect from Zion Health. Everything is transparent. If it's not on here, it's a case-by-case basis, and this is what you can expect from us. It's really easy to navigate as you're taking your employees through this, or your HR or whoever is presenting possibly the solution. This is really easy to navigate. Scroll down. We have a clickable menu over here. We can go to submission of needs. We can also copy and paste a link. By using that, you can also do Control F and search for, a particular thing, whatever is important to them. So with health shares, we do limit in how we share in pre-existing conditions. So we include everybody. Everybody is welcome to join Zion Health, but we just want to make sure that this is going to be the good fit for them. If pre-existing conditions are a concern for them, we do not exclude, but we do limit in how we share in those. So the definition for us is anything right here, a sign, symptom, or treatment in the previous 24 months to enrollment would be considered pre-existing. So we do have exceptions for high blood pressure, high cholesterol, and diabetes. So if those are well controlled, haven't had a hospitalization in the previous 12 months, then those would be excluded from pre-existing conditions. However, we do not share in maintenance medications, so those would not be shareable within Zion Health. But if you know you're savvy consumer of healthcare, you're going to be able to find your prescriptions through possibly Blink Health or GoodRx, or I don't know if I should share, but we're going to offer one as well through OptumRx, a discount card program here shortly. So they can take care of those maintenance medications through those, or there are organizations to help with diabetic supplies. There are a lot of solutions out there for those kinds of things. If it is a pre-existing condition, we do have a phase-in process. So we wouldn't share in anything related to that pre-existing condition in the first year of membership. We call that our waiting period. We would share up to $25,000 in the second year, up to $50,000 in the third, and up to $125,000 in the fourth year, and capped at that amount for each of the following years. So you want to make sure this is a good fit for your employee. If they have several pre-existing conditions, Zion Health is probably not going to be a good fit. Their DPC is going to help them navigate through this as well as they understand their medical concerns. If this isn't a good fit, if you're offering a non-insurance solution like a DPC practice and a Zion Health solution, then your employees are eligible to shop for their healthcare insurance plans on the marketplace and would make them eligible for a subsidy. If you are offering an insurance solution, they would not be eligible for a subsidy and would have to be looking at other solutions, possibly a spouse's plan or something of that nature. So it is a great service, but it's not a great fit for everyone, and we just want to make sure that it is. The last thing we would want is to have somebody join us and then realize that their health needs are not going to be met with us. So, but that is how we share in pre-existing conditions, so open to everyone. Let's see, if you're over 50 employees, please reach out to me. We do have that, like I said, the TPA, and we can work through those solutions as well. If you're considering an ICRA solution, I think that she had said that none of you are interested or have that on your plate as a solution, but I've just partnered with a company that I would be glad to connect you with, and they can help administrate that solution if that's where you go. Where an ICRA funds cannot be used for a DPC membership or a Zion Health membership, it can be used toward any other medical expense, including meeting your IUA or any small procedures through maybe small surgical centers or things like that. So it can be useful, it just can't be used for the actual membership fees. So anyway, if you're interested in that, please reach out to me. We do have partnered with a great company who offers that administration. So, and they're more than happy to do it. We've kind of run this past them already.
Hey, Heather,
So,
can I interrupt? I'm sorry.
absolutely.
Could you just define what an ICRA is for everybody?
Yes, sorry, that's my bad thinking you all know what it might be. So ICRA funds are funds that your company will allocate to each of your employees for their healthcare solution. And then you leave it up to the employee to decide what that is. If it is an actual insurance product, it can be done pre-tax. If it is not, then it has to be post-tax. But there are limitations not eligible, like I said, for a DPC membership or for a Zion Health membership, the actual fee. But any of the other medical needs that they have, it can be used for that. So yeah, that's what that is. So we have that great company that can help you administer those. I know sometimes that's a large thing to take on, but it is a solution that has been presented to me several times. So do you guys have any questions about what that is? Okay, great. Awesome. We'll just jump into the next portion. So about Zion Health. So
Hey,
if,
I saw
yeah,
your question.
yes.
And so, yeah, we'll address that. I'll address that. And I'll make sure that we get that. Any questions that are in the chat, I'll make sure that they get answered during the question and answer.
Okay, perfect. I will leave all questions to there. So
Okay, cool.
perfect. Awesome. So if your employee has a large medical need, and this is not something that falls under the DPC scope of practice, so that the way that would work with us is we would have our members submit a needs request, and then we would ask them to meet an IUA amount. So I'm going to jump here to our direct membership because it illustrates the IUA just a little bit better. So the IUA system is the initial unshareable amount, so the amount that we would ask the member to meet before we would share in their medical need. So say an employee they've broken their arm and needs some extensive surgery and maybe some follow-up physical therapy. We would ask the member to pay $1,000 towards those medical bills if they have chosen this IUA amount, and then Zion Health would share in the remainder. So that is per event. So if they have another large medical need, they would meet that IUA again, and then Zion Health would share in the remainder of those needs. Same thing for the third. It is capped at 3 in a 12-month rolling period. So the most a member could expect to pay for their large medical needs in a 12-month period would be that 3 times their IUA amount. So in this case, it would be $3,000. If there is a fourth need, I mean, we hope that doesn't happen, but it can. As long as those bills come to 500 or more, then we just simply share in their medical needs and we don't ask for that fourth IUA. So kind of a mercy, in my opinion. So we do have the 3 IUA amounts, 1,000, 2,500, and 5,000. Like I said, we're very simple, easy to work with. We want this to be very easy and to use and not confusing. So let's see. All right, so what I want to do now is kind of walk you through what it would be like for one of your employees to be a member of Zion Health. And I have created a member, and I'm going to call her Jane. And we're going to say that Jane has joined her DPC practice. She's happy with that, and she has her Zion Health membership in place, and she feels really good. She feels like she's covered on the little things and the preventative, and she's covered on the large things. So we're going to say Jane is enjoying her low-cost healthcare solution. She's happy with what she has. She feels relief. She's maybe visiting us here in sunny St. George, Utah. I don't know if you're familiar with this area. Gorgeous desert landscape. We have a Zion National Park here behind us, and there is a gorgeous hike called Angel's Landing. A very narrow, like, chain hike, right? But when you get to the top, the views are totally worth it. So we're going to say that she is here enjoying that with us, that she transversed to the top, took in those gorgeous views, and she's making her way down. We're going to say that Jane fell on the trail. She didn't fall from the from the large lift, but she just fell on the trail and maybe ensued a broken arm and maybe a compound fracture. So now Jane has a large medical need. And so what she's going to do is be transported to an emergency medical facility for possibly surgery and proper treatment and care there. So what Jane will do is she will present her Zion Health ID card. So we present all of our members with an ID card for all the information that a provider needs is found on there to bill us directly, either electronically or there is an address on the back. And the provider should be able to just submit claims to us electronically. We do participate in a network, this PHCS multi-plan network here. You can search for providers there. It is not required that you use the network for our services. Zion Health is available everywhere. If they are part of the network, then those in-network discounts are already in place. If they're not, our member care team is going to work on behalf for fair pricing. So she's going to present her ID card. She's going to get her services taken care of. And then when she is able to, we're going to ask her to come here on our website and submit a needs request. So for her needs request, it's very simple. Like I said, everything is online. We're very transparent, very simple to work with. She's going to input her first and last name, phone, and email so we can communicate with her. For her, this would fall under a regular needs request. You can see there's drop downs for other needs requests. If she has a maternity, you can see that what we expect and ask her to provide changes with that. So a regular needs request, any other coverage she has, and a box for all the descriptions. Here's where she can submit, if she happens to receive a provider bill or needs to show any other documentation, she can drop those files right here. This is what we would ask Jane to provide to us. What happened in her own words? When did she first start showing signs of symptoms? At the time of the fall, right? Any medications she's probably on, anti-inflammatories and pain medication, dates of service, any follow-up appointments. She's probably going to need to be casted. She's probably going to have maybe for some physical therapy appointments. She's go ahead and put that in there, and the providers to go along with those. And any itemized bills, if she's received them, like I said, drop them here. The next thing we would ask Jane to do is to meet her IUA. So the best way for her to meet her IUA is take one of her largest bills and pay that provider directly. So say she has a $5,000 surgery bill from that compound fracture, we would ask her to pay $1,000 of that $5,000 bill and then submit that receipt to us. Once we receive that, then we can start sharing in her medical needs with the community. So that's how that works for her. And what she can expect from us is help every step of the way, from any questions to enrollment all the way through needs processing. We're going to communicate with her by email. We're going to send her an email for when she opens the need, when it's determined if it's shareable, any provider payments, and then she'll receive an explanation of sharing and how we shared in her medical need there. So that's how that works with us. Like I said, you can see that we're simple, we're transparent, we're affordable, and we have created a membership to pair right along with a DPC membership. So this is a basic membership that is in place to take care of those larger or unexpected needs. As you can see, we're transparent. Here's our table of rates. There's no need to ask for a quote, and you can simply enroll online right there. We do have an enhanced membership here called Connected Health. So it comes with 4 added features. If these added features are important to your employees, then this would be the other membership to pair along with Mission Direct's membership. It does come with 1 outside visit per member. So if your employee needs to see a specialist, they're on vacation, and anything like that, as long as that provider is participating in the network, then we offer that as a service. It is shareable 1 time per year. We do have a preventive mammogram, preventive colonoscopy, and immunizations for children up to 16. So if these are important to your members, if maybe mammogram or colonoscopy age, this might be a great membership for them, or children who are expecting immunizations. So once you're ready to enroll your employer group, you would reach out to Elizabeth, and we will reach out together and we will design a solution that works the best for you. What we currently are using now is Hint, if you're familiar with that, and that's a platform where we would simply put your employer group in there, give you access. You would be able to enroll your employees. You'd be able to maintain your employees. If you need to terminate anything, then the great thing about this is if they're no longer with you, it's portable. They can take Zion Health with them anywhere. So they can take their membership with Dr. Hallgren and with Zion Health and keep those together and just take that right along with them. So it's not tied to your employer group necessarily, but we would just make that more of an individual offering after that. So it's a really great platform. We can bill you. You'll be invoiced for those. Those are individual memberships, so you would be invoiced for all of those individual memberships, and then an automatic payment every month for those. So a really simple solution, and I think it's great. After your members enroll with us, they'll, like I said, receive that ID card and the best member care ever. So our member care team is here for your employees. I'm here for you as a resource, and of course with Dr. Hallgren and Elizabeth. We're excited to partner with them. We believe in what they do. Like I said, we see the same vision, and we hope that you share in it with us too. So I know Elizabeth is going to ask me all the hard health share questions, and then she's going to open it up to Q&A for you guys. So let's just have at it, and I will give her back control here. Let's see if I can figure out how to do that.
Yeah, let me be reclaimed as host.
All right, you should have that back.
Thank you.
You're welcome.
Can you stop your screen share, please?
Yes. There we go.
Thank you. That was really great information, and I really appreciate it. I'm going to just go over two quick things. I've talked to all of you guys, but I just want to make sure to just kind of illustrate where we fit into the whole, we being direct primary care, fit into the what Heather was talking about. So she talked about it in really simple fashion, was that basically healthcare costs can be put into two categories: hard to predict and expensive. So following on the angel hike, which is terrifying. John and I have done it.
We have, and it is, there are some parts where it's a little sketchy.
And then the second bucket would be predictable and affordable. So Zion Health is a non-insurance option for those hard to predict and expensive costs, and Mission Direct Primary Care is a solution for the predictable and affordable, which includes those wellness exams, acute visits, and chronic disease management. Just real quick kind of overview, that's exactly what we do here and do really, really well. And we have the time in our, John and Angie have the time in their schedules to manage people's chronic diseases, get them healthy, work on a really comprehensive plan to manage those as well as possible. In addition to acute care needs, kid stuffs something in his nose. That's been a favorite, stitches, those kind of things. Of course, wellness exams.
Dislocated patella, perhaps.
Wellness exams and in-office procedures as well are included, and that's something that people get a lot of value out of: wart removals, mole removals, stitches, and then of course family planning procedures that we have available here. And so I wanted to just ask some questions of Heather. We have a few questions in the chat. I have some questions that I just get all the time about when I talk about health shares. I'm going to put us back on gallery view. There you are. I'm going to see if I can spotlight both our videos. I don't know. So Heather.
Yes.
So every health share does their kind of member sharing thing differently. Some of them are on a reimbursement basis, and some of them will pay the providers and service providers directly. Can you kind of clarify how Zion, you talked about submitting it, so it sounded like it was kind of a combo, a little bit that you pay directly as the member and a little bit that Zion pays.
Right, exactly. So the model that we have is submitting claims electronically. We work directly with the providers. The only time we would ask our members to have a reimbursement type model, it's not even really a reimbursement, but to work with their providers, is to pay their IUA amount directly to the provider. And once we receive a receipt from that, then we work with the provider and pay all medical claims. So I know sometimes health share is a new idea. Sometimes providers aren't familiar. We do have a large hospital chain here in Utah that refuses to work with health shares, and we work around that by working through the member and jumping into their portal and paying on their behalf. So it is workable. We can do a reimbursement model. Obviously, if the provider is not willing, or maybe just paperwork and things got lost in the mix, we can do a reimbursement model. But what we like to do is make it simple for our members and just work directly with the providers.
Okay, great. And can you review the maternity benefit? That's the question I also get all the time.
For sure. I wish I could screen share with you, but our maternity need is very simple. We cover, we share in everything that is, I'm losing the terms, before baby, during delivery, and post, prenatal, there we go. Prenatal care, postnatal care, and everything related to the delivery. So for the maternity need, we ask our members not to become pregnant within the first 60 days. So that is conception date. But once we do have a maternity need, we share in everything related to that. If there are complications, prenatal complications, those are shareable. Delivery is shareable. We have to have an emergency C-section, and anything related to the delivery, if there are complications, that's shareable within the maternity need. So for that, we do ask for 2 IUAs. I consider it one for mom and one for baby. So that would meet 2 of the IUA requirements in that 12-month period for that family enrollment. We do share in home births. So if we do have a successful home birth, as long as those as long as that total cost of the home birth doesn't exceed what would typically a hospital birth would be.
They're not legal here.
They're not legal there? We'll just skip that. But we would only ask for one IUA in that instance.
Okay.
It's not legal for, well, we can just skip it.
Yeah,
It's
we
basically
can.
very-
Okay, great. And birthing centers, are those legal as well? Kind of a hybrid? Okay.
Yeah.
So that,
So basically two IUAs. So if your IUA, if your initial unshareable amount was $1,000, $2,000 for the
total. Mhm.
Okay, great. So is the company involved in the sharing process at all, or is that all directly handled privately with the member?
I'm not sure what your question is.
Like when a member has a need, when a member's on a company paid plan, is all that just handled through the members portal, not involving the company?
Exactly. It's considered PHI. It would be handled directly with us. Yeah.
Okay. And you went over how it was billed. Can you you went over it really quickly, and I thought one of the more interesting things I've learned as we've been preparing this presentation is that with small, under 50 employers, if you offer a non-insurance benefit, but an insurance product is better, that their employee can still get subsidies. Did I understand that right on the exchange?
So if they are offering an actual insurance product, then because they're offering an insurance product, then they wouldn't be eligible for a subsidy on the exchange. They can still go to the exchange and participate in a program there. It might not likely be worth it for them because they wouldn't have that subsidy, but they can do that. They just or can have that insurance plan, excuse me, but wouldn't be eligible for a subsidy for those plans because the employer is already offering an insurance product. So if you're offering something outside of that, so the DPC membership and a health share, Zion Health together, you're not offering an insurance product. So if this isn't a good fit for the employer, they have pre-existing conditions, they want to go somewhere else, then they can visit the exchange and be eligible for, and see if they're eligible for subsidies.
Okay.
So I hope that made
That's
sense.
a really good option.
Yeah.
I think, and I did not know that until I have spoken with you. And then so can you speak a little bit, are there any tax benefits for an employer to do this or no?
There's not. It would all have to be post-tax dollars.
That's what I thought, but just
Yeah.
check. All right. Like I said, put your questions in the chat and I'll get them answered. Garth, their organization is nonprofit's looking to grow to more than 50 employees this year. But you said that you could arrange kind of plans specific for larger groups, right?
We can, yes. Congratulations, by the way. Growth is great right now. So we do have a TPA company that we work with called Planston, and they do offer MEC plans, so those minimum essential coverage plans. They do make you ACA compliant. Everything preventative is included in there, which is part of the ACA. You're going to avoid the A tax by offering that. They do have two versions. One would really just kind of overlap what the DPC is providing, which is kind of a copay, but what the best one that I've seen paired is the HSA. So it has a preventative care, which kind of crosses over with the DPC, but it does keep you compliant. It offers telemedicine, which probably, I don't know, do you offer telemedicine? Okay, so there's a little crossover there. But what it also offers is an HSA card, an HSA account. So it's set up for free. There's no monthly fees to do that, and then your member can use their DPC practice for preventative. They can use the HSA for any medical expenses. Just filter it through there. That's where the pre-tax benefit is going to come in there. It keeps you compliant, and then you can add the health share on for the larger unexpected needs. There's even a dental and vision option you can put with that, and you can put all of those services all in one list bill through that TPA. So you're not working with multiple companies. There's just the one. So you'd have Dr. Hallgren's DPC membership, and then that one list bill for those other services. So that would keep you compliant and have a complete package.
And you can pay for the DPC with the HSA money?
You cannot. No, not right now. I have had that question before. Yeah, I wish you could.
Definitely. That would make too much sense.
I know. That would be too easy. Then everybody would do this. Why would we open that door? Right.
And then, like I said, you can connect directly and
connect directly with me and we can get you set up there. You can research them and get that information, see if it makes sense. But congratulations. That's awesome.
We also had a question about that expanded coverage that you last talked about that covered some of the immunizations and the one outside visit. Can you explain kind of what that is? Like it's just for a specialist visit, right? Like if,
Mhm.
okay.
Yeah. So say one of your patients or your employer needs to see a specialist. We have high blood pressure. We can't get it under control. We need to see a cardiologist and see what's going on. As long as that cardiologist is participating in that PHCS network, that would be fully shareable with us. It's not subject to the IUA. It's just simply shared with us one visit for that year. Or if your member is on vacation, they have something happen, COVID, they have to go to urgent care, get tested, things like that. That would be shareable with Zion Health as long as that clinic or those providers are in network. So the preventive mammogram is shareable, preventive colonoscopy. So if it's diagnostic, we're suspecting something, that wouldn't be shareable, but if we're just doing a routine, we're just staying up, an ounce of prevention is worth a pound of cure, right? Then those would be shareable with Zion Health, and immunizations for children up to 16. So anything that the CDC is currently recommending on immunizations, those would be shareable within Zion Health. So not subject to IUA, just added to that membership.
So that's just so that outside visit would just be outside the DPC practice.
Exactly. Yep.
And then Dan had a question about, is Zion nonprofit or for-profit?
We are a nonprofit organization.
Great. And you're called Zion. When I first approached you guys, and
is this you? I think I know where you're going.
And the church, I wondered if you were associated with the Mormon Church.
Mm-hmm. No, we're not.
No.
Yeah, I can see that. It's really to mention that Zion National Park, but really even that name comes from a religious background. But no, I had somebody approach me and say, they said, now it's just so great that those Mormons, they have a health share. I think that they should have had one, and that's just not the case. They said, no, nothing against Mormons. I just don't want to be one, but that's just so great. And he just kept going on, I just kept saying, we're not religiously affiliated, but it was a funny conversation nonetheless. So no.
I have a follow-up question. Is the IUA per family or per person? If you're on a family plan,
Good question.
IUAs for the year?
It's for the enrollment. So if it's an individual enrollment, that applies to the individual. If it's a family enrollment, the IUA applies per family. So 3 IUAs per family or 3 IUAs per individual.
That's good. And that's one of the points. I have this chart that if any of you guys are interested in, that talks about how the questions you should ask when you're comparing health share plans. And that is one of the questions because it varies greatly between health share plans and companies, how many IUAs you have to pay in a given 12-month period. And Zion's 3 per family is on the lower side of what this industry standard is.
Yeah.
So most of them are more than that I have seen. But as always, I encourage people to do their own research. Any more questions, guys? When was Zion started?
The beginning of 2019, so January 2019. Our founders were involved in the healthcare solutions before that, got into health shares a few years before creating Zion Health, really saw the community idea and created Zion Health, and it's just phenomenal. I tell them all the time, you make my job easy. All I have to do is explain you and what you've designed. So a really great company, really great product.
I'm going to just ask 2 kind of questions in closing. I want to be really, mindful of everybody's time. What kind of business is this not a good fit for? Are there folks that this isn't a great fit for?
Maybe if you have a more of an older population. We don't compete in the Medicare market, so our membership stop at 64. If you have a population that is maybe, I'm trying to think, that would have several pre-existing conditions, just really we're appropriate for most places, and I would say really just the elderly or several pre-existing conditions depending on your population.
Okay. And my final question is, what makes this a good deal for businesses to think different? I mean, why should businesses be thinking differently outside of the insurance market?
Yes. I'm going to say numbers right out of the box. You're going to save 50 to 60%, and you're going to feel like your employers have a complete solution with a DPC practice. If you're over 50, the HSA to keep you compliant, and the health share, you're really going to see a 50 to 60% savings. I invite you to look at our website and compare the rates of what you see there. Even if it's completely sponsored by you, you're going to save more than traditional insurance. And I know with traditional insurance, what's going on right now is, and I'm sure you're aware, is we're going to have a high premium. If you're a family, you're looking at like $800 to $1,200 per month to have a high deductible, probably $10,000. So you're already paying, you know, over $1,000 a month for your membership and protection. But then when you have something, you're going to pay out of pocket for those bills up to $10,000, and then you get covered. So I think you're going to see a value across the board on this.
That's one of the things I really like, is it's so simple. And so just for kind of transparency's sake, I think it's about 158, 150, something like that for
About for an individual,
yeah,
on the 1,000
for you
IUL.
guys, and it's 99 for us, and we discount for a larger employer, you know, based on the number of employers. So for around $250 a month, you have a benefit for your employee that they see first dollar coverage in. The first time they come to Mission Direct Primary Care, they don't pay anything. You know, they, and every time after that, and except for wholesale prices for labs, which run, you know, $6 versus over $100 for the same lab in an insurance-based payment model.
And if I can jump in for just a second, I know the DPC model is really, they're advocating for their members. So if they have to do a service outside of what the DPC does, or outside of, you know, in between what Zion Health wouldn't cover, they're really going to direct them to a diagnostic center for their labs, or they take care of labs there. But I've seen this model where they direct and help their members shop for their healthcare. Hey, did you know, instead of going to the hospital for, you know, an MRI, you can visit this standalone facility. It's still a quality care. You're going to still get the same MRI, but it's going to cost you $300 versus, you know, $800 or $1,000. That's really what DPCs do. And there's an added value in there. I just wanted to throw that out there. I see that all the time, and I think that is worth mentioning.
Yeah. So I'm just, you know, kind of first dollar benefit for employers, and it allows smaller businesses to be competitive, and, you know, attract and retain the best folks. And any questions as we kind of wrap up? I really appreciate you guys all taking your time. It's nice to see everybody showing.
Me too. Thanks, everybody.
Out and about. So thank you very much. And if you have any questions, just reach out to me. You know, I'm always available, and we'll help connect you with folks that can get those questions answered. Next month, we're doing this again, and we will be having a company called Virtuous Benefits that specializes in level-funded insurance-based plans for small businesses under 50. So if that's something you're interested in, keep an eye out. I'll be sure to invite you. But we are just focusing this month and next month on small businesses, and then doing the same informational type gathering for individuals in October and November. Just trying to be a good source of information for our people. So, but thank you, Heather. I really appreciate your time.
You're welcome. Of course. Thank you guys for all of your time today. Let me know if you have questions. Reach out through Elizabeth. We would love to talk to you.
Thank you.
All right.
Thanks, guys.
All right. Thanks, guys. Bye.
Bye. It's nice to see you, Dan.